Hi everyone. Today in this video let us talk about one of the new agent, Brivaracetam. What is this drug Brivaracetam? The suffix racetam indicates that this drug acts on the brain. Brivaracetam is one of the antiepileptic agent. This drug can be used in the treatment of partial onset seizures. We have another drug with similar suffix, levetiracetam. Both of these drugs belong to the same category and they are antiepileptic agents. But there is a small difference between the brivaracetam and levetiracetam. Brivaracetam is one of the newer agents compared with levetiracetam. Both of these drugs target synaptic vesicles of glutamate within the CNS. These synaptic vesicles are equipped with one of the protein SV2A, synaptic vesicular glycoprotein. This protein is responsible for release of glutamate from the synaptic vesicles during the exocytosis. Both levetiracetam can bind to this protein as well as brivaracetam can bind, but brivaracetam is one of the newer agent which is having the more affinity towards the binding to this SV2A protein. So compared with levetiracetam, brivaracetam is having the 20 times more affinity. Thereby, it can show better pharmacological actions compared with levetiracetam. So this is one of the newer agent which is used in the treatment of partial onset seizures. And this drug is available as tablet as well as oral solution. It's also available as injection form for intravenous route. But today in this video we are going to discuss brivaracetam tablets, how to take these tablets, what is the dosage, what are the important precautions, side effects, and how this drug acts to control partial onset seizures. All these things we will discuss in this video. First of all, let us see how this drug acts. Within the CNS, glutamanergic neurons store glutamate, and this glutamate can be released and it can act on postsynaptic neurons which are equipped with glutamate receptors like AMPA. But the release of glutamate from the presynaptic nerve terminals is controlled by voltage-gated calcium channels. So when the calcium enters into the presynaptic neurons, glutamate is going to be released by exocytosis and it can act on the AMP receptors. Once these AMP receptors are activated, they can stimulate the voltage-gated sodium channels. So sodium can enter into the postsynaptic neuron, which results in the excitation. In this way, glutamate can increase the excitation within the CNS, which if it is uncontrolled, it can trigger high-frequency neuronal discharge, leading to induction of seizures. If these seizures are located to a particular area of the brain, then it is called partial onset seizures. Here, another protein that can control the release of glutamate is the SV2A, synaptic vesicular protein, which can increase the release of glutamate during the exocytosis. Now, brivaracetam can reduce the partial onset seizures. This drug can act in three ways. One of its primary target is the SV2A protein, where it can inhibit the activity of this protein, resulting in the decreased release of glutamate. In this way, excitatory neurotransmission can be controlled by brivaracetam. Similarly, it can block the voltage-gated calcium channels which are responsible for exocytosis. Thereby, it can inhibit the release of glutamate. Now, the third target is the GABA receptors, which are inhibitory in nature. And here brivaracetam can activate these GABA receptors, resulting in inhibitory response. By all these actions, brivaracetam can control the neuronal discharge, thereby it can reduce the partial onset seizures. Now let us see precautions of this drug. One of the important precautions of brivaracetam is that this drug can increase the neurological effects during the treatment. Just like many of the antiepileptic agents, brivaracetam can also produce few of the neurological symptoms like somnolence, sleepiness in the people, fatigue, lack of energy, and it can also produce some dizziness, lightheadedness. All these effects may impact the daytime activities in the patient. That's why whenever brivaracetam is administered, care should be taken while driving the vehicles or working with machinery, because this drug can reduce the attention and it can increase the sleepiness in the people. In such conditions, care should be taken, which may lead to few of the accidents during the driving or working with machinery. This is one of the important precautions with use of brivaracetam for controlling partial onset seizures. So any development of neurological effects should be carefully observed. In case of severe neurological symptoms like hallucinations and severe lightheadedness, in such conditions, this drug should be carefully used. Second important precaution is that this drug can also produce psychiatric effects. Because of this action, brivaracetam can produce some agitation in the people, irritability, anxiety, and it can also produce some depressive symptoms. So all these psychiatric effects can be observed with brivaracetam along with neurological effects. Since this drug acts on the CNS, these effects are commonly observed. But when these effects are more pronounced, then care should be taken while using this brivaracetam. In such people, the dose of the medication may be reduced. Otherwise, in case of serious side effects, this drug may be replaced with other antiepileptic agents. Until unless there is a serious side effect, the dose of brivaracetam should not be suddenly stopped. It should be slowly tapered over a few days in order to avoid any sudden induction of seizures in the people. Just like many of the antiepileptic agents, brivaracetam can also produce some hypersensitive reactions. So it can produce some bronchospasm, which is particularly more important in the people with any respiratory disorders like asthma or COPD. Similarly, it can also produce some angioedema, swelling of face, neck, tongue, as well as lips. So in case of severe hypersensitive reactions, brivaracetam should not be used. Similarly, this drug can also increase the depressive symptoms in the people, which may increase the suicidal tendency. That's why whenever this brivaracetam given to the adolescents with age less than 18 years and young patients with age 18 to 24 years, the suicidal tendency may be more pronounced. So in such people, brivaracetam should be carefully given. Now let us see the side effects of this drug. The important side effects mainly include the nausea and vomiting, and it can also produce some gastrointestinal side effects like constipation. It can also produce some imbalance in the body. So postural imbalance is one of the important effects of brivaracetam, and other central effects like irritability, somnolence, sleepiness, and dizziness are commonly observed side effects with brivaracetam. Now let us see the chemical nature of this drug. So this is the structure of brivaracetam. Here we can observe amide as functional group. Let us give the numbering. This is 1, 2, 3 and 4. So simply it is a butanamide. To this butanamide, at the second position, one of the side chain is present. Let us give the numbering to this ring. This is 1, 2, 3, 4 and 5. So this is nothing but pyrrolidine, which is attached by first position. So we can write this as pyrrolidine 1-yl. To this pyrrolidine, at the second position, keto group is present. So 2-oxo, and fourth position, propyl chain is present. So 4-propyl. That is a simple name of brivaracetam. How it is given? This drug is available as a tablet at different strengths such as 25 mg, 50 mg, 75 mg and 100 mg. It is also available as oral solution in the adults with age greater than 16 years for the treatment of partial onset seizures. The recommended initial dose of brivaracetam is around 50 mg given twice daily. So initially it is started at a dose of 100 mg per day, which can be increased to a maintenance dose of 200 mg per day given as divided doses. So during the maintenance, it can be given 100 mg twice daily. But in few of the people, the dose can also be reduced such that it can be given as 25 mg twice daily. Interestingly, this drug can be given in the children with age greater than 1 month. But in such pediatric patients, the dose of brivaracetam is fixed based on the body weight of the children. Normally, the dose range is variable from 0.75 to 1 mg per kg given twice daily. So that's all about this drug, brivaracetam, which is one of the antiepileptic agent that can be used for the treatment of partial onset seizures. This drug acts just like levetiracetam, but this drug is having the more affinity towards synaptic vesicular protein SV2A compared with levetiracetam. Neurological effects and psychiatric effects are the important effects that can be observed with brivaracetam, and it can also induce the depression which may lead to suicidal tendency. So in the young and adolescent people, this drug should be carefully given. So that's all about this drug, brivaracetam. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.